Hello, everyone.
Hi.
Good afternoon, everyone. Welcome to today's webinar. My name is Ishika, and on behalf of IIHMR Bangalore, I'm absolutely thrilled to co host today's webinar alongside our moderator, Dr. Usha Manjunath, ma'am. Before we dive in, a quick audio and visual check before we start. If you can hear me and see me, please drop a yes in the chat box. I'll get started. Okay, so firstly, as a foreign medical, you all put in on your medical degree, but the healthcare ecosystem rapidly evolves, and your clinical knowledge holds immense value in areas beyond traditional practice, from healthcare management to hospital administration to healthcare technology, growth and initiatives. Today is going to be all about showing you how to leverage with that medical degree of yours. Now,
Is she audible? I'm unable to hear.
Yeah, your audio is not very clear, Ishika.
okay, ma'am. Just a second. Is this better now, ma'am? Okay, continue. Ma'am, you
Looks like there's some glitch in the audio, but yeah.
Okay, I'll continue, ma'am.
Yeah.
Okay. Now it's a privilege to introduce our distinguished panel, accomplished leaders, and IIHMR Bangalore alumni who have walked this path and built remarkable careers in healthcare industry today. Guiding our session today is our moderator, Dr. Usha Manjunath, ma'am. She is professor, director at IIHMR Bangalore, a visionary leader in healthcare management, education, and research. Introducing our guest speakers for the day, we have Dr. Purvi Deshmukh.
Okay.
Yes, go ahead, Ishika.
Ma'am, let me press this one. Just a minute.
I think Ishika is facing some network glitch. Meanwhile, let us know from where all you have joined this session. Can we drop a message in the chat box? From where have you joined this session? Okay, Bangalore, Hyderabad. That's nice. Bangalore. Any
New
other
Delhi.
place? Jaipur. Okay. So we have a diverse audience here, joined from various places. New Delhi, Andhra Pradesh. That's very good. Maharashtra. Yeah, the session is going to be very interesting. Just allow us one moment. Ishika is facing some technical glitch. Meanwhile, if you have any questions, just a quick question for any of our speaker, you can go ahead and ask if you want to in the chat box.
Yeah, or do you want us to go ahead and start introducing ourselves? Would that be better?
Yes, ma'am, that also can be done.
All right. Okay. So I think she's got
Yeah,
her
I think
slides
she's
up.
back.
All
Yeah.
right. Okay, great. All right, Ishika.
Are you there, Ishika?
Hello.
Yes, Ishika. You are
Yeah.
audible.
Yes.
Go ahead, Ishika. You can start.
Yeah.
I hope things
Hello.
are fine. Yes. Yeah.
Yes,
We
yes.
can see the slides.
Am I audible now?
Yes. Yes.
Okay. And I'm also visible? Yeah.
No, you are sharing your screen, na? So you are
Ha.
not
Okay.
visible. Yeah.
Yeah, you are visible,
Yeah.
but
Now.
you can go full face, but then that's okay. Yeah.
Yeah.
Okay. So we'll
Yeah.
I'll get started with introducing guiding our session today is our moderator, Dr. Usha Manjunath ma'am. Dr. Usha Manjunath ma'am holds a PhD and MPhil from BITS Pilani. Since assuming the role of director in 2017, Dr. Usha Manjunath ma'am has significantly strengthened IIHMR's Bangalore academic standing, transforming it into a preferred destination for a healthcare management education. She is also the winner of Bharat Ratna Indira Gandhi Gold Medal Award and named a Paul Harris Fellow in 2022 by Rotary International. She's also published 25 plus research papers, authored Total Quality in Healthcare, and leads global projects with partners like UNICEF and John Hopkins. Coming right now to our three guest speakers for the day. Introducing you the guest speakers, Dr. Purvi Deshmukh, Dr. Akanksha B. Ramteke, and Dr. Pavan Kumar. Dr. Purvi Deshmukh has done her MBBS from Georgia, PGDM in Hospital and Health Management. She moved from clinical operations and quality manager at United Hospital, Bangalore to clinical administrator currently at Apollo Hospitals. She has brought her foreign medical degrees perspective to hospital administration, pursuing an MBA in hospital and healthcare management at IIHMR Bangalore alongside her hospital role. She served as a student representative at IIHMR Bangalore and anchored Innovate Health South Asia and INHSA 2024, building strong communication and cross-functional coordination skills. Currently, Dr. Purvi is an administrator at Apollo Hospitals. She also brings deep operational expertise. Our next speaker for the day is Dr. Akanksha B. Ramteke. She has done her MBBS from China, followed by a PGDM in hospital and health management. Dr. Akanksha is currently an assistant manager managing OPD business finance at Bokhard Hospitals. She brings crucial insights into managing a hospital alongside business and financial growth. She is also very good at demonstrating how young foreign medical graduates can move into management roles soon after graduating. Our next speaker for the day today is Dr. Pavan Kumar, who's completed his MBBS from Philippines, PGDM in Hospital and Health Management. He's currently working at KIMS Hospital as a general manager heading growth and new initiatives. He's previously worked with Medsi Hospital, Gemcare Hospital, and Incor Hospitals before joining KIMS. Now, I would now Without a further ado, I would now like to hand over the platform to Dr. Usha Manjunath ma'am to kickstart the panel discussion. Dr. Usha ma'am, over to you.
Sure. Yeah, you could disconnect the slides, please.
Yeah.
Yeah, I invite and Arun, please spotlight uh, Pavan as well as Akansha.
Yes, ma'am, doing.
Yeah, and welcome everyone, and I think it's a special treat. I know they introduced me with so many things, but I think I'm a teacher, and I really enjoy being with my students. And looking at all the young doctors who have joined us today, FMGs, and this is a great opportunity to spend next 45 to 50 minutes talking about the things that our students have achieved and what is the field of hospital management, tech-based, management programs that can do to your career, as well as artificial and intelligence. All right. So once again, good evening and a very warm welcome, and welcome to our live webinar and the live webinar Beyond FMGE, Management and Tech Career Pathways for International Medical Graduates. As the director of IIHMR Bangalore, it's a privilege to host you today, and it's a special privilege to have my alumni with me talking and discussing. First, I want to celebrate the incredible resilience and global perspectives that you bring as foreign medical graduates, traveling abroad to master medicine and returning to clearly, working on clearing your regulatory requirements, exceptional grit. You're highly valuable cohort of medical professionals for India and beyond India. And traditionally, the post FMGE pathway has been viewed very narrowly, let us say, crack the exam, do an internship, immediately dive into intense competition of NEET PG for an MD or an MS seat. While that remains a noble path, clinical pathways are very, very important, and the structural realities of medical workforce are shifting. So our national research shows that traditional clinical timeline in India is highly elongated, and it's nothing that just the research has to say. I'm sure all of you here, as well as me, have known this, and often meaning doctors don't hit stable independent career velocity until their late 30s. Furthermore, over 90,000 graduates annually and much more now. The urban clinical job market is also getting saturated, leading to flat baseline salaries and maybe slower career growths as you look at. So our institution's, recent national research and white paper on human resource for health highlights two critical macro trends. That means what is happening with the medical graduates that are shaping the medical careers in India. One is the saturated urban aggregation. So India has produced over 90,000 MBBS graduates every year. However, due to legacy infrastructure models, nearly two-thirds of our doctors aggregate in urban areas. So there is a lot of need in rural areas, but most of the doctors are getting in the urban areas. This creates an incredibly crowded urban clinical market and also huge competition, and leading to stagnant early career salaries and stiff clinical competition. So that's the first scenario where our urban centers are getting very, very saturated with medical graduates. The other is the elongated professional timeline. I already said the traditional clinical pathway in India is unusually extended. Between baseline medical school to internships to residency preparation and postgraduate specializations, many doctors do not achieve stable independent career velocity well late into their 30s. And our research strongly conclude that early career medical professionals need a dynamic modern strategy. That means maybe all of you should be able to build a portfolio of capability. And that's what Dr. Akansha, Pavan, and Purvi have done. And I think so you will be hearing from them. And therefore, this is very important because your hard-earned medical degree is a powerful foundation, but its value is no longer confined strictly to bedside care. So today's healthcare ecosystem is, really looking at undergoing a massive $1 trillion transformation, huge number, right? and driven by corporate hospital networks, global health tech platforms, public-private partnerships, and health informatics. So we generally know as health IT, maybe EMR, and so on. The industry is hungry for professionals who understand clinical workflows, which all of you do, but also possess strategic capability to manage organizations, optimize the operations, and scale the technologies. So choosing management or tech isn't about leaving medicine behind. So you will hear from them. It's about leveraging your clinical expertise to make massive systemic impact on healthcare delivery. So you are a doctor, you will be able to bring in better operations, better operational excellence, understand medicine, and then maybe you will make a major change in the way it is managed. So you have your treat single patients, but here you impact many more people. Today, we want to share a powerful, empowering truth. Your global medical degree is highly prized, far beyond traditional bedside practice. The modern healthcare ecosystem, driven by enterprise hospital networks, global health tech platforms, and corporate healthcare groups, and also insurance sector is undergoing massive transformation.
Yes.
So one is I would like to assure everyone here that we all wonder, what is the difference between an FMG and an Indian MBBS? So there is an industry equivalence in healthcare management and technology sectors. Corporate recruiters view FMGs very similar to Indian MBBS counterparts. So your medical degree carries the exact same weight and you are hired with absolute same professional status. And then you also can look forward to accelerated career velocity. Moving into management and technology offers significantly faster career progression than traditional clinical tracks. This we kind of want to say that and insist on that. And instead of waiting years to climb linear clinical hierarchies, and a medical management professional scales you into leadership roles very fast. I am from a clinical field of speech and hearing. I worked in the field for very long, and I think I landed up when I came back from US at BITS Pilani. Pilani is a small town. I couldn't really, I did work in my own field of speech therapy and all that, but I had an opportunity to work at BITS Pilani, and that's when I did my career change to hospital management, doing my MPhil and PhD at BITS Pilani, as I was working at the management department of BITS Pilani in Pilani itself. So I think it gave me a very vast approach, a very vast landscape to work in, and I'm very happy today. I'm still in the health sector. I'm still very close to what I do. I have working in the management part, but as a faculty and a teacher. So here can be very, very different and very good. So the health IT, the AI and tech revolution, the future of medicine is digital, as all of you know. And through IIHMR Bangalore's pioneering specialized programs, the PGDM and in the healthcare management, we have a cutting edge focus on health IT, AI and data science, and we build true digital readiness for all our students. So we equip medical graduates with AI literacy, data-driven decision-making, operational tools required to lead the industry. Today, so now all of you know that your degree is very valued. You can definitely, those of you who want to pursue the clinical areas are definitely, you know how to really go about. This is something that you want to explore, the management part of how we can really do in hospital management or health management, health or the tech and the health IT and AI and DS. So welcome once again. And I'm very happy. We are joined by three exceptional IIHMR alumni who stood exactly where you are standing right now. And they recognize their unique value, stepped into management and tech, and have built high velocity, incredible, rewarding careers for themselves. And this is just the beginning. They are not, they're very fresh also, 2-3 years or 4-5 years, and that's it. But you will hear from them. And so they have built very rewarding careers, and let's hear from them. All right. So, are we ready, Dr. Purvi? So what I'm going to do is, very quickly as they speak, they will introduce themselves too, briefly as we go along. So, Purvi, maybe now that you're a clinical administrator at Apollo Hospital, so my question to you, Dr. Purvi, is many FMGs worry that stepping away from traditional bedside practice means losing their identity as a doctor. How do you
Right.
use your medical background daily to lead clinical operations at Apollo hospitals? And how has this path accelerated your career faster than a traditional clinical role? So, quickly introduce yourself, and the floor is yours. Yes, over to you, Purvi.
Hello. Hi, am I
Yes,
audible?
yes.
Yeah, hello. Very good afternoon. I'm Dr. Purvi Deshmukh. First of all, it's a privilege and honor to be a part of this seminar, getting in touch again with my roots, to be honest. So, I come from Gujarat. I have finished my MBBS degree from Georgia. Post that, I came to India. I cleared my FMG examination. I did my internship and got myself registered. Post that, I moved to IIHMR to pursue my PGDM in hospital and healthcare management. Hello.
Yes, yes, we are able to hear.
Yeah, I hope my audio and videos are okay.
Yeah, video, there is a little lag, but we can hear you well.
Yeah, that is probably due to the network issue. But anyway, so correctly said by ma'am, many FMGs they think that moving their career into management will lead to they'll medicine they are somehow less of a doctor. Uh, to be honest, I also used to think along a similar line. Uh,
Yeah, Purvi, maybe you want to switch off your video, then maybe we
about
have a
there is
better
something called
audio.
hospital management back in the day.
Purvi ma'am, please
Yeah, let
turn
me
off
just
your.
try, ma'am.
Yes, Purvi, go ahead. I think hopefully we'll have a better audio without your video.
Yeah,
Yeah, go
yeah.
ahead.
So have that fear, and to be honest, even I did, but 2 to what to do next, what to do for PG, whether I should apply for a PLAB, whether I mean foreign medical graduates being exposed to
Purvi, we have some problems. Do you
their
want
master
me
degrees in
to?
UK have to or they have to come back to India.
Purvi, can you rejoin, please? Whatever you're saying, it's hard to
Or
understand, and we are unable to hear it properly, your story, and we really feeling disappointed on this. Kindly, please rejoin.
Yeah, sure. Okay, give me 2 minutes.
Thank you.
yeah, maybe in the yeah, in the meantime, maybe Akansha, and you can go ahead and introduce yourself.
Hi, ma'am. So I was actually looking for the photos, and I really skipped from my mind the photo what we clicked on the last day when I was pregnant, and you gave me a best STP winner medal and a prize, and I am still
Okay.
searching it somewhere in the laptop. So nice
All
being
right.
here. I'm very nostalgic, seriously, and I'm feeling very good, very great. And is anyone from China here? Can you just tap me in the message if anybody from China, from Shenyang, from Thailand, from anywhere, from Guangzhou? I don't know. I just wanted to talk in Chinese for a little bit with them, but still no problem.
Okay,
So,
that's great. Okay.
so
Huh.
I started, as you know, I have completed in 2023, and I had a little bit break because of some health issues. But just because I have done my PG from IHMR and I have done a very good summer training program, I landed up in Wokhar. Actually, I have done my MBBS in 2006, completed in 12-13. I was DMO for past 6 to 7 years. I have been in Gurgaon, been in Delhi, been in Visakhapatnam, been in Hyderabad, Medical, high tech city. So I have been in 3 to 4 different hospitals as DMO. And then I wanted to switch my career because while talking to patient, talking to relatives, talking with the consultants, I understood that how the work-life balance sometimes hinder our health issues and our family as well. And I was already married at that point of time. So I was very clear in my mind कि it's better we go to management because I'm very good at talking with relatives. I always because I was already done my MBBS. We have a clear picture of clinical knowledge. Okay, but non-clinical sometimes we are unable. Consultants don't have time to talk. We in India, consultants don't have time to talk to relatives. They only talk with patients. They give the medicines and go back. But in UK, US, and other countries, consultant give their time to relatives as well. They give their ample amount of time before surgeries, post surgery. There are n number of Indian consultants do give, but I'm not. I'm just comparing. If you compare, I think at that point of time I understood that I am a better person to talk to relatives, to talk as a management, to be in admin level. So at and I understood that I have to see something which is a very good foundation for me as in management. And in that case, I was trying to n number of different types of courses, certification. There are a number of things. We as FMG students, we do keep searching everything because we get a differences, we get a comparison, we get that, and that is the truth. We do get that. See, if there is a neurophysician and neurologist, we do a comparison of there. If there is a surgeon and this is a laparoscopic surgeon, we have a comparison there. So it is obvious that we are going to get a comparison, and if we have to face those comparisons, then let's stand and face it. So on that purpose I understood that chalo hame to kuch karna hai, where I will lead and I will tell doctors what to do, or I'll tell the management how to lead, I'll tell the hospital how to do that. I know how to do it because and the thing is that I didn't stop doing the job when I was in IIHMR. Even I used to do some telemedicines, or I used to give an online consultation. We have to have a clinical knowledge. So if beside having a good clinical knowledge, we have to do this management course as well. And this 2 years offline, we can do it. We can do some online clinical courses as well, or else a hospital night shifts. I was doing night shift in my when I was freshly graduated. So this has lead me to work hard, and work hard. I just went work hard and gave my resume. They just seen my resume. का MBBS भी हो गया, चलो अच्छी बात है. IHMR से हो गया है, चलो और अच्छी बात है. Because I have done my PG over there, I have done my STP program of what we say that ICU bundle branch. ICU bundle branch means there are three types of patient in ICU. You can see ventilator, in urinary tract infection type of patient, or some other different patients. So I used to have that project. Ki how are the sisters, nurses, how is the ICU running? And on that basis, my project was so good because the sample size was something like 1,500, something for 2 months. And that leaded me a very good opportunity in Wokat right after IHM. I had a gap in between. Yet I landed up in a very good organization and I got a very good position over there. And I look after now TPA. TPA is third party. We have a subject on that TPA. And then corporate. CGHS is healthcare of all the government people. Those I take care of all the OPD. The whole OPD system is in me. All the consultant, how when should you see the patient, when you should not see the patient, when is the VIP patient timings, everything I decided. And then even we have a business strategy, how the revenue leak, where is the revenue leakage, and how should we have a strategy to avoid a revenue leakage. There are n number of revenue leakage, like we can see a loopholes or gaps. So this thing which I have learned in IIHMR and I am implementing in this in work hard. And it was very good news that right now I have two offers as well. Just because after this TPA and work hard and this management, sometimes a very, what do you see that, a very best foundation can lead us a very good roles eventually. My career started little bit late because of marriage and children and everything, but slowly it has started, so I'm very happy on that.
Okay. So, yeah, very quickly, somebody is also talking about various opportunities in the field. So, what are some of the opportunities? Maybe I will, go ahead with Pavan. What kinds of opportunities, the kind of, programs that we have, where you will be able to really make a difference. So, Dr. Akansha's was that based on her this one, she has been a very successful hospital administrator and a manager, and she's working on operations. And so she's an assistant manager, operations OPD and business and finance at Wockhardt Hospital. So that is in terms of managing a hospital. Maybe we could come back on different operational issues. Maybe I move on to Pavan Kumar, Dr. Pavan, as a head of business development. So also tell us your career pathway and other opportunities for hospital management. If they are seeking hospital management, what kinds of career pathways do you, expect for the medical graduates?
Yes, ma'am.
Yeah, go ahead.
Am I audible, ma'am?
Yes, you are.
Hello. Yeah.
Yes, go ahead.
Yes, ma'am. So, ma'am, I just want to say it in one line. Once they entered into management pathway, uh, there is wide number of opportunities will open for them. There is not like two or three. If they are being still in clinical side, they have only one route: is doing their PG and doing their DM, entering into the market and trying to get the patients, coping up with the corporate. It's a single line way. But once they entered into the portal of management, people generally think management itself is like only operations, finance, or marketing. But generally, if you open this pathway, you can enter into a way, it's multiple ways. I'll just tell you an example. In India, especially, the healthcare was growing in a very fast track model. For example, if you see all the corporates are now controlled by bigger MNCs. Now the Care was under Blackstone, Apollo is a big chain, Manipal is a big chain. So all the investors for this big corporates are funded by the foreign MNC companies. So right now the opportunities are so wider because the world is looking towards India for healthcare because its affordability is very good. Better care will come, better experts will come. So with these three kind of align, the whole world is looking towards India. So at the same way, even the foreign investors also started investing in India in a very bigger way. I think that's the number that is ma'am telling before regarding the trillion market business here. So in this way, there is a kind of so much of gap is there to fulfill this market. The gap is coming from the administration part, especially the business. Especially, see, there are doctors here, multiple doctors with very clinical expert, with due respect towards them, but there is a gap of a guy who will think about business. For example, there's one guy in my hospital who do kind of a procedures which in India no one can do that. He's in top 10, we can say that, but nobody knows that he's doing in India. See, that's the place where we need to play a very key role in fulfilling the gap. The gap is everywhere in this market, especially. Can you imagine? I'm the reason why I joined medicine. I mean that BIPC and all is because of maths. I really have a lot of fear in my 10th grade and all. My last position is in Omni Hospitals. I'm the PNL head. I take care of profit and loss for the whole chain. Can you imagine you having a medical knowledge, you having a business knowledge, you have an exposure for international market because we all studied internationally, and if you have a basics about finance, I'm telling you, you can you can control the whole game in India. And the Indian graduates can't do this because they spend their 10 years of their lives with books. Even we do that. But in a way, what I want to tell you, at least we have out of box nature. We do think a lot because we stay outside for 5, 6 years and we think a lot. So I just want to tell one thing is like entering into management itself will open multiple doors, especially there's corporate marketing, which was booming now in India, trade marketing booming now in India. Forget about corporates. If you see the role right now, what I'm doing is growth and new initiatives, which was a very different role what I'm doing right now. Can you imagine my target for this anime is 167 crores, and which is very doable. That's the market in India. So right now we are working with robots for surgeries. Right now we are working with oncology departments. Right now we are working in IVF sectors. So there are multiple ways where you can fit into, multiple ways. So if the few doctors who have passion towards gynecology, don't worry, you can join here as an IVF business expert. So your goal towards patient care will not change, but the model will change. You may not treat the patient, but you will become the barrier between the clinician as well as the client. As simple as that. You just need to change the mindset. And I'm telling you, the pay is really, really high here. Really, really high. I'm so happy right now. The reason is I'm withdrawing more than a consultant today. And I'm deciding a consultant salary also today. I'm
Yes.
not joking. That's a fact.
All
And I just
right.
want to tell one more backup option for you. If you guys still have a confusion, I know after you graduate, came to India, your mother and father will say, "Arey bhai, you need to be in medicine. You
Yes.
shouldn't leave clinicals." I'll tell you one thing, prepare for your exam. That's what I did. Prepare for your exams, join in IIHMR, whatever institute that you want to do, finish your MBA, put it as a backup. If you cleared and still you want to do clinical pathway, you go ahead, no worries, but this will be your backup. You can enter into any, I mean, you will definitely get a job easily, I'm telling you. No need of placement I'll just put it in your portal, you'll get a job.
Sure. All right. Okay. So we will come
And we
back
are
to
there to
you.
help you out for
We
sure.
will come back to you. Yeah, yeah. So we will come back to you again, Pavin. That was great. So, in terms of various positions,
Sure, ma'am.
healthcare is
Sure.
growing, and you said maybe it is operations, quality, IT, facility management, lead hospitals. In a short time, maybe even with your medical as well as your management degree, you could probably move up the ladder faster and maybe head various kinds of hospitals as facility manager or CEO. And currently, the work that you do in finance as a P&L, profit and loss account, and international market, I think that sounds very, very important and good to really know and take care of business. So I think your clinical knowledge, understanding medicine, how doctors and patients really work around this, and then building for the hospital to really grow and ensuring that the patient experience is good. The patients are going to really be happy and get a great experience as well as clinical outcomes. And I think your roles are very critical, and that was great to know. And we see now Purvi is back. Purvi, you want to talk about various roles in your as an operations and heading, the clinical operations at Apollo. And so you can tell about the role and how this path accelerates your growth, as well as some of the other roles that, Dr. Pavan and Dr. Akansha spoke about, but other roles that are possible in the hospital and health. And we can further move ahead and expect to talk about more on health IT and others, which I will add as we go along. Yes, over to you, Dr.
Sure.
Purvi.
Thank you so much, ma'am. First of all, I'm so sorry there was a technical glitch, so I had to drop the call. So to be honest, I connect to a lot of points what Dr. Pawan has highlighted. First of all, students they opt MBBS as to save themselves from maths. To be honest, that was one my condition as well. Like if you think 10 years back, the options what we got was either engineering or a medical or medicine. So we as a student never knew that courses like this existed. To be honest, when I was into MBBS, suppose that when I came to know I have an option of healthcare management where I can use both my clinical knowledge and my managerial skills to lead a hospital. I at that point of moment decided ki okay, this is going to be my career path. So I relate to that so much, and there will always be a fear, like in the medical graduates' heart as well as their parents' mind. Even my parents were like, "Why are you leaving your medical practice?" But actually, your medical knowledge is your biggest strength. That helps you make so many operational decisions. For example, you being a clinician as well as an administrator take helps you take an decision. Like for example, two patients are there, which patient to prioritize, which patient is critical, who needs the bed first, if there is some blood transfusion to be done, what tat should be there, turnaround time, how in how long you should be able to take the blood, transfuse the blood. That all this clinical knowledge is your strength to help you take the operational decisions, which actually improves the quality and the patient safety, to be very honest. If you see role wise, me being a clinician, we have a lots and lots of options. For example, clinical operations, it helps me, the coordination between the consultants and the different departments. You being a clinical administrator, you work as a bridge between the administration and the clinical team, that is the nursing, the technicians, the doctors and everything. It helps you bridge the gaps, because few things which clinicians cannot think from the business perspective, what Dr. Pawan has told, and same administrative decisions, sorry, the clinical decisions which administrative people cannot think. So moving forward, I believe doctors running hospitals will is the future of Indian healthcare industry, to be very honest. Looking into the roles, what we can get is, for example, if you see a MBBS graduates role journey ahead, it will be either MD, MS. Post that you will be joining as a resident, registrar, junior consultant. Similar way, there is the journey of a clinical administrator as well. For initially I was there in United Hospital as clinical operations and quality manager. Post that I moved to Apollo Hospitals. Now I work as clinical administrator. If I see my career growth, it is towards senior clinical administrator, clinical care head, if you can say, DMS, and eventually to the medical superintendent. Now if I say, all the hospitals, they have the mandate or they have the requirement that the medical superintendent of the hospital has to be an MBBS. That leads to the opportunity of so many MBBS graduates along with their healthcare management degree to be the medical superintendent. You are the one who will be managing the hospital, the clinical aspect of it. You will be the one who will be taking decisions related to the consultants, to the business decisions related to the clinical care. So yes, obviously the career opportunities being an MBBS graduate and an MBA in healthcare management are a lot.
All right. Um, yeah. Yeah, Purvi, I think the last part we missed a little bit, but I think Purvi really did a career role from, the clinical operations that she's working and clinical administrator to, senior clinical administrator to, Purvi, we are not able to
DMS.
hear you. Yeah. Yeah.
Hello.
So we are not,
Yeah.
yeah, we are,
So see,
yeah,
yeah,
now,
clinical care head to a DMS to a medical superintendent. I mean, that is
yeah.
how an ideal growth is there in any organization. It may differ from organization to organization, to be honest. But the speed of the growth is, the sky is the limit, to be honest.
Okay, thank you, Purvi. And yeah, in terms of so the career pathway, she kind of did more on the clinical and medical side of it going forward. I think there is some glitch from her. So if we, okay, so, so, but then I think going forward to medical superintendent, whereas Dr. Pavan talked a lot about, international market, pricing, finance. So you saw the different kinds of career pathways in hospital management. Dr. Akansha moving ahead and talking about the operational aspects of it, managing various units, really supporting patients, attendants, families to really move ahead in their career. So what I would take a small this one here before we move ahead, for those of you who are looking at, say, for example, doctors are also very well sought after for the pharmaceutical management too. And there are various opportunities. I mean, pharma is the limit, as you all understand. Clinicians are very much important, whether it is in terms of product management. So somebody was asking me about, asking in this, what are some of the opportunities for growth? So pharma management would also provide you with product management, liaising officer, scientific officer, clinical research, then innovation officer. One of our own MBBS doctor who worked in the hospital and who joined us, Dr. Sandesh, he is with 5C Network, an AI company, as a product, management person, and in terms of building the business. So these are some of the opportunities over there. So I will kind of go back to Akansha, just to kind of highlight, how does your time at IHMR prepare you for to handle modern tech-enabled operational environments, and what advice you would like to give to FMGs looking to build their management skills? Like, say, for example, you already spoke about internships. So especially in the tech area, how they can build, what kinds of things that would help them build their career.
Yes, ma'am. Sure. I would like to tell one more thing to all the freshly graduate, because I have seen someone talking of Pavan Sulakhe is telling that about some issues, like are the all the hospitals, good hospital like Apollo or anybody, they, or do they need an experienced doctors, or they need anything which is placement, how is about the salary and everything. I would like to just highlight few things to all the freshly graduate students who came from the FMG and aspirants and whoever they are. See, children, they right now they are my siblings, and you can say they're like my children. When I was freshly graduated and I got a placement from two new good company. One was Mylan and another was Karkinos. Mylan is pharmaceutical and Karkinos is an oncologist, something from Hyderabad, I guess. It's in Hyderabad. So I think Pawan is from Hyderabad. Is Pawan from Hyderabad? Hello?
No, I'm from Bangalore itself.
Okay, you're Bangalore. Okay.
Yeah.
So, graduate who are freshly graduate students, if you do from IHMR, there's see, they may ask you for the experience, and as I told you, you can get a good experience while doing a night shifts. You can continue your such type of if you feel that they are not gonna we are not gonna get a job, so you better try for a night shifts or do some see we say that on call duties. You can do those things to get a experience on clinical basis, but I'm giving an assurance that after and while the placement you have n number of door opening from pharmaceutical, from clinical research, medical writing, medical reviewing, regulatory affairs, medical informatics, health informatics, medical coding. There are so many. You can see my LinkedIn account and you can see, you just try to understand what is the market and what are the courses needed. When I was freshly joined in IHMR, there was one madam who told Kirti ma'am. Kirti ma'am was there, our dean ma'am, and she told us that how different type of courses you have in Coursera, how different type of certification you have, that helps with IIHMR as well. IIHMR is already providing us with pharmaceutical, IT, and hospital. And as I have seen, Pawan is also in hospital. Our Purvi Deshmukh is also in hospital. I am also in hospital right now. But apart from there, the other industry of health sector is so vast. so big. There's a guy Ayaz Sheikh in LinkedIn. If I can, you can find him. Ayaz. He was in safety department in TCS. Now he is in Accenture, and he just gave a interview for a VP, and he is as passed out as I am right now. So even he has done his MBBS, and he has done his MBA. Not just in hospital. We are very good in running hospital, as Purvi said, because we have already done an MBBS. We have a clinical knowledge plus this. But if you want something to change, like pharmaceutical, regulatory affairs, medical writing, medical coding, clinical data, there are huge, and there are good courses as well. Along, like, just after an placement, you'll find that. So this is a very good opportunity, and if you want, you can just contact me. You can contact any of us so that we can help you that what all you can go ahead. I know after 18 plus 5 hours, even my parents think that मेडिसिन क्यों नहीं लिखती, पेशेंट को क्यों नहीं देखती, ये सब रहेगा ही रहेगा, पर उसके ऊपर हम काम कर रहे हैं. I understand what are the who should be given first priority. I know the medical management, ICU management, or the surgery patient. I can differentiate and I can tell them. And even if any consultant is arguing, we are here to talk. We can give answers and we can tell them, sir, this is mandatory for the hospital, not for just for your patient. We are working for entire hospital, so we talk for hospital. We don't talk for ourselves. We don't just talk for patient. We talk for whole hospital. That is the reason. So, so it's very easy. It's very good. It's very fascinating to come in health sector because it is so vast. It is booming, and all the other countries, they are coming and investing here. It's a very
Okay. So I think not only hospital operations and the things that she learned and how it helped, Dr. Akansha highlighted a lot of things that a medical graduate with pharmaceutical management can also do. Moving ahead, Dr. Pavin, IHMR focuses heavily on digital readiness, health IT, AI, and data science programs for healthcare professionals. So from an industry perspective, how does having strong AI literacy and tech readiness give an FMG a massive competitive edge when applying for top tier corporate healthcare roles? Yeah.
So I think we are hearing everywhere that AI is entering into the market, and it was literally taking a lot of jobs and all. I think we all know that the people who have knowledge on AI, they will cherish a lot actually. And to be honest, even I am from last 6 months, I'm also being trained in AI. I'll tell you few lines. Not only this healthcare department, almost every department is moving towards this AI and artificial intelligence and all. So especially in healthcare, there are few places where AI really plays a very key role. One is robotics. Right now, this gastroenterology, surgical gastro, all general surgeries, and all gynacs, and all surgical onco. These all four departments. I believe that in coming 5 years, these all four departments, surgical department, will become robotic departments for sure. It's already started, by the way, in all the corporates. So because of XYZ reasons, the volume of blood that what we lost in the surgery is very less. The complications are less. Infection rate is less. So these all machineries are run through AI intelligence. That is one way where if we have a lot of knowledge and upgrade ourselves in the AI, we can cherish in these departments. And in operations, it is everywhere. I'm saying in operations, if you want to have a smoother operation, if you want to, because we as a human, we can't control the whole hospital. There are around 700-800 people are there working in a hospital with around 500-600 clients will be there every day. So AI plays a really key role in operations by optimizing the processes, by getting the alarms, by just, it's just for the smooth flow. AI again play a very key role there. That is number two. And number three, one more, where in the system of bookings especially, and even in call center lines also, right now the AI is taking entering into that line, even in healthcare. So all these ways again AI was entered. And I just want to tell you, just upgrade yourself. With your healthcare knowledge, with your administration knowledge, and with your AI knowledge, you will become unbeatable again in the market. And there is a lot of scope. People are looking. And I want to tell you one more thing. In healthcare, there's one good news for us is people who are working in healthcare from so many years, they are not technically driven people, including consultants. They don't know technology much. If you are the person who can talk about technology, there will be a very big chair waiting for you there. Okay, so please try to enter into that line and learn more about AI. Then once you enter into the job, you can integrate it, because even right now, healthcare, mein, it is not so integrated like other departments, like in other other models. Healthcare means still it's processing, and future is there. If you have the knowledge, you will be the one who can integrate the AI knowledge with the healthcare, and you can sit on the top chair for sure.
Okay, so Purvi, I do see one question by Alban John. So I'm kind of managing both. So is there any friction to get the first job? What can be the starting salary, and what time does it take to get a salary on par with consultant? Just wanted to know on an average. Yeah.
Okay, so to answer the question, to be honest, they getting a job, it totally depends on the skill, what skill you have, how you have built yourself in 2 years when you are doing the course. The starting salary package can be anywhere between 6 LPA to 10 LPA. That depends on the organization and the role which you will be applying for and getting selected. And the more you get experienced in this industry, the more you get paid. So I cannot tell exactly how long will it take to come at par with the consultant salary, but I can assure you, the better you perform, the better you gather the skills. There is one thing, you need to keep upgrading yourself in this industry, because it is a very fast changing industry. You need to be aware about what is going on. Like Dr. Pawan said, AI integration, it is there in almost every single department nowadays. The more you are updated with the system, the more you have the skills, the better you grow in the industry.
Sure. I could just put in a word, and as an extension to what Dr. Purvi said, a consultant starts to earn much later, and it takes a long time for him to start earning. So maybe with a management degree, you start early, in the sense like if you are soon after your MBBS, 2 3 years or 4 years, and you start, and then you are still a doctor and a management specialist, or an health IT specialist, or a pharma management specialist, then your growth in after the first 2 years takes off much faster. And I think, like we have one medical doctor who did artificial intelligence and data science. Just recently he passed out and he is working, and he has a salary of about 20 lakhs, just, at a very young age. And, in fact, so this is a very important part, that the career growth that you will have, and your readiness, like Dr. Purvi said, in terms of skills and upgrading, but also like liking what you do as a manager, plus working with people, and the kind of hospital jobs that you get would definitely be much higher. So if I'm really going for health IT, there are opportunities, health IT and artificial intelligence, as a data analyst, research associate, market research specialist, medical scientist, interoperability, and, this one as a, in companies like Deloitte and many of the consulting companies, you start at a fairly good salary, and you grow up and you have a corporate type of a job. Again, in insurance sector, again, whether it is in claims management, risk assessment, actuarial, this one, you have very stable corporate jobs, but you will be actually applying your clinical knowledge to work in that particular sector. So starting in the insurance sector could be 7 to 8 lakhs per year. Our own students within 2 years have reached 12 lakhs, and the growth becomes much faster. So as you see, the paying part and the insurance part in India is also fast changing. a lot of insurance companies and payment is happening through insurance. And so there are greater opportunities there also, as well as in the health IT and artificial intelligence. So those are some of the things. If you are doing health IT, I could also say, for example, some of our students have done US healthcare, joined, various companies which work. As you know, a lot of the work is outsourced to India, and a lot of these consulting companies actually manage the EMR and various other things for the US hospitals, or maybe UK or Ireland and so on. So there could be possibility for on-site, maybe Australia, China and USA. So there will be on-site jobs which is coming up. So you work for 2-3 years. There is a possibility that you would also be traveling to help at the on-site. All right. So those are some of the opportunities. So going ahead, what I would like to do is, if there is any specific questions that you would like to ask, I mean, maybe we could take those questions. If you want, please go ahead and put it across. So far we talked about, as a clinical manager, what are some of the opportunities? All our students today, alumni who are here, are in the hospital sector, but hospitals are also expanding very fast. For example, Narayana Health, if you have heard about, is not only a heart hospital, but it's also a multi-specialty hospital. It also has a separate technology one called Atma. Now they are entering into insurance. So the hospital sector is also expanding. So if you have worked, there are so many more opportunities as you go along to really, look at. There are opportunities in UAE and others again. If you're a clinician and a management specialist, there are a lot of opportunities to manage hospitals within India as well as other places. Now, the investments are also happening not only by Indian investors in the healthcare, it is across. So Asia, South Asia, Southeast Asia, everywhere there are investments happening in healthcare. So there is a possibility that you could be working on international divisions and so on. So there is that part of, thing. All right. Yeah. Can you please clarify? One person has asked the placement options for allied health professionals. Okay. So does someone want to take it up, or, yeah. Dr. Pavan, do you want to take it up?
If I may
Yeah.
take the question.
Yes, Dr.
So
Purvi.
actually, post your PGTM, it won't be like you're they won't see what graduation you have done. You will be a master, a PGTM in health, hospital and healthcare
So she's
management.
asking regarding allied.
Yes. Dr. Purvi is answering for
Yeah.
what would happen for the allied health professional after PGDM.
Yes, so you have many options or lines available. For example, there is quality management, there is marketing job, there is operations, which eventually has also a lot of steps to go ahead and excel. So, to be honest, your graduation, what you have graduated in doesn't matter, but your skills and what you have learned throughout the 2 years in PGDM will be the one based on which you can take a decision. There are a lot of options available in terms of which department to choose moving forward.
Yeah, I think, how you have learned in PGDM program, it's a master's equivalent program, and how you actually apply. So it is the aptitude, it's your communication, it's your ability to work with teams, as well as understanding, hospital, healthcare operations, and ability to really manage that. So even, the course prepares equally, the medical graduates or the paramedical graduates, and we also have non-paramedical, where they may be coming from BCom and others, but they may be good in finance. So they also are able to really master this. Okay, so Dr. Hamsa would like to know the course in detail, maybe I could take that up. We have a Hospital and Health Management PGDM, which is our flagship program, which is a 2-year one. It is equivalent to an MBA, as we have an NBA accreditation and with the AIU certification. So it is then it has the specializations. So earlier, from 2020 onwards, we have had specialization also in pharmaceutical management. This year, we are doing pharmaceutical management as a separate program. So you still have the hospital and health. In that, we have public health, health IT specialization, as well as hospital management specialization. Majority of the people also choose to be in hospital management or health IT. Some choose to be in public health. Public health also offers, attractive careers, but it depends on how you kind of choose that. So first year, it is a common course on management, healthcare, data, and understanding the health sector itself. And then in the second year, you choose the specialization subjects. So at the end of first year, you take up 3 months of summer training program, which is equivalent to what we call as internship in other MBA programs. In that, this year, I would like to say that, paid internships also are increasing for us. So by the end of first year itself, you are hired with some money to really for the 3 months that you do an internship. So you do internship depending on the specialization you want to take. The other program is Artificial Intelligence and Data Science, which started 2 years back, and our students are placed now and they will be graduating this year. And we have had a smaller cohort, but this year many people have already taken that program. There you get, again, you have internships. The structure of the program is similar. They will be learning a lot on the health sector, management part, and then technology and artificial intelligence and data science. A lot of the data analytics you do will be more focused there. So in artificial intelligence and data science. So that's another whole program that we have. This year, we have introduced pharmaceutical management. You can be a doctor, you could be a pharmacist, you could be a PharmD graduate, M Pharma graduate, B Pharma graduate, but you have to be a basic bachelor's degree should be there. You can join that. You could be a medical person. Medical persons also do very well in pharmaceutical management. And that is, we already have experience in that. And this year we are starting that as a full-time program. So that gives the structure is that you actually, in the second year, you start the placement specialization courses. Then you move on to, start working towards placement and you get placed. In the last 4 months, you could be really placed and complete your dissertation, come back and get your convocation done. So we have the convocation on July 25th, where our second year students who have finished, who are already, almost all of them are already placed, but just for 1 or 2 people who are now, kind of finalizing, but they have got a dissertation in a particular organization and they are coming and getting convocated and they will continue their jobs as they go along. So that's the structure we have. So almost 7 months, you are already in an industry. All right. Be it pharma as you choose, be it hospital, be it a health IT company, consulting, insurance, or hospital, or startups with AI and data science, or doing health IT and data science and this in the hospitals also, because there's a lot of implementation that's happening there. Whether it is the EMR, EHR, or, artificial intelligence used for diagnostics, lot of tools used for, improving, the administrative efficiencies. So you will have various kinds of jobs available based on the specialization you have done. And of course, you have to really be good. We will provide you with the swing, but you have to crack the placement. And we definitely prepare from day one you join to really go ahead and, be able to do well in your placement. And, I'm sure, I've been here, this is, completed almost 16 years at IIHMR. What I've seen is the students, once they get the job, they all become very professional and they come back and like you're seeing our alumni here, they are talking very differently than what we probably even taught them. So I think this is a great, way to really see how our students grow. And I think, it's also very, for a teacher, one of the most rewarding thing is see our students excel in the things that they do. And I think that has been a great opportunity for all of us as faculty to really see that. Yeah. Any other question or?
Actually, sorry to interrupt. To add to what you have said, 2 years back I was there in place of Miss Ishika, Dr. Ishika. I'm sorry, and today I am this side, and it's a really an honor to be a representative of an IIHMR.
And Ishika is our just fresh BDS graduate who has joined us, and we have put her on a good job of really monitoring and helping all of us to perform well. And yes,
Hello,
so
everyone.
any last bit of thing from Dr. Akansha and Dr. Pavin? I'm not seeing any more questions on the chat, but you could, just your last. Yes, Pavin.
Nothing, ma'am. Thanks for the opportunity. So, for anybody that if they really need more assistance, we are always there to help them. As being part of IHMR, definitely there is a lot of opportunities out there. We can really guide them well too. Thank you so much for the opportunity, ma'am.
All right, great. Dr. Akash has also put the details. All three programs are 2-year full-time. First year, you have 2 terms and 3 months internship. IHMR supports for the internship. Sometimes students themselves find opportunities. You could want to work in your own town or city. The second year have 2 terms. Placement season starts at the end of 3rd term and mostly post Diwali, around Diwali and Dussehra. And if you get placed early, you can also opt for some 1 or 2 coursework. If sometimes, people ask, the placement organization asks for an early release, which means you start earning faster. So sometimes we allow that because looking at the career path, but then, that's one part that Dr. Akash has put. Thank you, Akash. Yeah, any other last word from Dr. Akansha, and then we will hand it over to Dr. Ishika.
Nothing much, ma'am. I'm so, as I already said, I'm so nostalgic. And I'm feeling so great to be part of IHMR. And now we all are family. So being a mother or a sister or an elder or an alumni, everybody know where to reach me out. And I'm happy to help all the people because I know I was there at one point of time, freshly graduated, back to home. What to do? There are a lot of so many questions, so much confusing. And I know we have to, there's a part where we have to take care of parents. What we have to do is that what they want, we want to do that as well. And sometimes even it's our desire as well. There are so many confusing things to take care of, like what family is saying, what we want, where the industry is leading. Sometimes our parents don't understand that how the health sector is booming, how big it is, and how where it will be leading us. So there are so many things might be confusing, but we all are here to help all the freshly graduated and little doctors.
Yes. Yeah, I think, I'm sure there will be more questions, and I'm sure you can, feel free to connect to us, and then we will in turn connect to Dr. Akansha, Dr. Purvi, and Dr. Pavin. And I think it's time to kind of end this wonderful conversation and great interaction. Thank you for being such a good audience and asking some of the questions and really wanting to explore. And I think you should really explore, but there is a great career ahead if you choose to be in the programs that we talked about in hospital and health management, or the specializations of pharmaceutical management, artificial intelligence and data science, or in terms of hospital management and specializing in hospital management itself, or maybe health management, or that is the public health part, and health IT. Health IT is equally a very good career with your medical knowledge to really move ahead. And so that's from us, and maybe Dr. Ishika will time for Ishika to kind of thank formally and wind up the discussion. Yes, over to you, Ishika. Okay, is Ishika planning to wind up or?
Hello, Ishika. You are not audible. Still, you are not audible. Meanwhile, we would like to request all the participants to kindly fill the feedback form and let us know your feedback for this wonderful session. I'm handing it over to Ishita for thanking everyone. I think she's facing some glitch. Give us a moment, please.
And we hope they have really kind of benefited from this, and they could probably start looking at their career and planning career, whichever way it is, whether you choose to continue to work on your clinical areas or consider hospital management, artificial intelligence, health IT, or pharmaceutical management. All the best to all of you, and I'm sure you will shine with your background and others. And thank you all, and we will continue to engage further. And having all of you here, it's been wonderful. Thank you all. I am not sure if you want a photograph. Ishika, you want a photograph?
Yeah, that would be okay, ma'am, but I have something to say.
Yes.
Can I
Go
please
ahead.
take over?
Yeah.
Firstly, I would like to say it was very nice interacting with my seniors. It was a very insightful session. I learned so many things. So I would like to say thank you to Dr. Usha ma'am and a huge thank you to Dr. Purvi, Dr. Akanksha, and Dr. Pavan for sharing such their inspiring journeys and actionable career advices. Seeing how medical background can be leveraged in administration, growth strategy, finance truly proves that your career just doesn't stop at FMGE, it only expands further. And if today's session sparked your interest in exploring structured pathways into healthcare management and health technology, IIHMR Bangalore is here to help you navigate. We've dropped a few helpful links in the chat box to help you explore IIHMR Bangalore programs and to get in touch with our admission team. And thank you over again to our amazing panelists, to all our attendees for your fantastic energy. Wishing you all the very best ahead.
Thank you so much, Ishika. Thank you so much, Usha ma'am, for having us. It was a privilege.
Thank you. Yeah, thank you, and all the best.
Wishing all the participants all the very best for making a decision on whether to continue your clinical practice or a non-clinical one. But trust me, IHMR Bangalore is one of the best platforms to pursue your management studies.
Sure. Thank you all. Thank you,
Thank
guys.
you, ma'am.
Thank you,
It
ma'am.
was wonderful
Thank you,
meeting you and
everyone.
seeing you. Yes.
Thank you,
Thank
ma'am.
you, everyone.
Bye.
Thank
See
you,
you.
everyone.
Bye-bye.
Yeah.
Bye bye.
Bye.